breast augmentation, pre-op. We want to do everything possible to ensure that you have a comfortable and safe experience at our clinic. Please review the following pre-operative guidelines before the day of your pre-operative visit, and also at least 4 weeks prior to the day of your scheduled surgery. If you have any questions regarding your surgery or any of these guidelines, do not hesitate to call our office. In order to prepare for your procedure, we would like you to optimize your health and avoid anything that can adversely affect your healing. Here's a timeline of how to prepare. For at least 4 weeks prior to surgery, please consume a healthy diet that includes plenty of protein, nutrients, and water. Avoid inflammatory foods including processed carbohydrates. Take a multivitamin and probiotic daily. Obtain at least 8 hours of sleep per night so you're well rested and not worn down. Avoid crowds, viruses, and other illnesses. For at least 4 weeks prior to surgery and at least 12 weeks after surgery, please do not smoke tobacco, consume nicotine or cannabis, or vape, as these can seriously impact healing and increase the risk of healing problems such as infection, tissue necrosis, and wound breakdown. 4 weeks prior to surgery and before the day of your preoperative visit, please ensure that you've obtained any required medical evaluations, labs, or tests, and that the results have been sent to and received by our clinic. For at least 2 weeks prior to surgery, please do not take over-the-counter blood thinning medications such as ibuprofen or aspirin. If you have a minor ache, plain acetaminophen, also known as Tylenol, is permitted. For at least 2 weeks prior to surgery, please do not consume alcohol, herbals, or supplements, as these can also adversely affect healing and anesthesia. 1 week prior to surgery, please ensure that you have obtained your pre- and post-operative medicines, supplies, and/or garments as prescribed. 1 week prior to surgery, please ensure that you have confirmed your plans for transportation, accommodations, and aftercare. 5 days prior to surgery, please apply mupirocin ointment 2 times per day to the inside of both nostrils. 5 days prior to surgery, please wash your body with chlorhexidine gluconate, also known as Hibiclens, once per day up to the day of surgery. Using the mupirocin ointment and chlorhexidine before surgery can help to reduce infection. The night before surgery, starting at 12 midnight, please do not have anything to eat or drink because your stomach needs to be completely empty for anesthesia. Before midnight, drink at least 2 large extra glasses of water so you're well hydrated overnight. If these instructions are not properly followed, your surgery may be canceled. If you are taking prescription medications for high blood pressure or diabetes, these may be taken at their normal times with small sips of water. If you are taking prescription medications for other medical reasons, please check with your surgeon to see if you can take these medicines before surgery. When you have general anesthesia or sedation, a responsible adult who is over the age of 18 must drive you home and must be able to stay with you overnight once you return home from surgery. Please do not wear makeup, contact lenses, dark nail polish, high-heeled shoes, valuable items, or jewelry or piercings of any kind to your surgery appointment. Please wear loose, comfortable, warm clothing with a zippered top to your surgery appointment. Please bring all of your prescribed medications and garments with you to your treatment appointment. Plan to rest for the remainder of the surgery day and avoid strenuous activity for at least 6 weeks after surgery. The patient should not drive a vehicle, operate any machinery, or make any important decisions for at least 48 hours following the anesthesia experience. If you develop lung or nasal congestion, the flu, a cold, COVID, or a fever, please advise us as soon as possible and at least a few days before surgery. Women, please note, some antibiotics may interfere with the effectiveness of your birth control pills. Please check with your pharmacist. We would like to take a moment to speak about the importance of your mindset. Please channel as much positive energy as you can throughout your entire journey, before, during, and after your procedure. The more positive energy you channel, the better you will feel and the better you will heal. It's natural to be nervous or anxious before surgery, but please do not let these feelings overwhelm you. We are going to take care of you.